Hepatitis C. What is hepatitis C? Hepatitis C is a viral infection that stores inside of the liver and it invades itself. This decreases the ability for it to be able to fight off invaders and causes vulnerability for infection. It creates antibodies that attack the immune system. This increases chronic inflammation of the liver and over time causes serious damage to tissue, which is scarring of tissue, or in other words, fibrous tissue. This progresses to cirrhosis of the liver and even liver cancer. These are two conditions that are very serious and can lead to transplantation or even death. Blood-borne virus. This means blood-to-blood contact. This can be due to unsafe practices of needles of people who are infected with hepatitis C, or it could even be caused by an accidental prick of the finger of a healthcare provider who is treating or taking care of somebody with hepatitis C. How many are infected? So about 130 to 170 million are infected worldwide, and at least 300,000 to 500,000 are infected each year. Signs and symptoms. Most of the time, people do not have any signs or symptoms. This could take years or even decades for them to even to have their first sign. By the time this happens, damage has already did major damaging to the liver because it slows down blood flow. One sign is jaundice, which is yellowing of the skin and eyes. This is due to blocked bile ducts and high pressures and buildup of bilirubin, which is bile pigmentation. It is a substance that's formed from the heme portion of hemoglobin. Old and damaged erythrocytes that are broken down from the spleen and the liver. Bilirubin is extracted from the blood by hepatocytes and it actively secretes into the bile. This is a secretion that goes into the bile ducts and it's taken in from the liver. It is yellow and it contributes to the color of bile. Some of the bile pigments are absorbed in the blood, and because the liver is not functioning properly, this creates buildup of bilirubin, accumulation in the blood, and it diffuses into the tissue. And this is what creates that yellowish skin and eyes. This also gives urine its color, but with cirrhosis, the urine is probably very dark. And it also even gives stool its color. But people with cirrhosis, their stool color may change, or it will change to a pale coloration. Ascites, which is water retention in the abdomen. This is large amounts of fluid that causes swelling in the perineal cavity. It can be painful and it could cause someone to have hard times of breathing. It could be very uncomfortable for them to even try to sit down because the abdomen is extended. This is an extension that could even go really far by making the person look like if they were maybe 9 months pregnant. The fluid can be drained. There is a procedure called aesthetic drainage, and it's a procedure that consists of a needle and a catheter that is inserted into the abdomen, and this is what helps drain the fluid into a beaker. Another symptom is hepatic encephalopathy. So because the liver is no longer functioning and it's not able to get rid of toxins, the blood and the toxins is accumulated and causes excessive amounts of ammonia. And this causes mental confusion, loss of memory, forgetfulness, and even intellectual impairment. This could even cause slurred speech, or somebody can wind up into a coma or even death. Edema, this is accumulation of fluid in the legs and feet. This is also buildup of fluid retention. So this is increased pressure in the portal vein, or in other words, portal hypertension. Blood is not able to um, go through the liver to the intestines. So what happens is the small vessels start to leak out fluid, and this is when swelling begins to arise. So easy bruising and bleeding. So cirrhosis stops producing and slows the production of proteins that helps blood to clot. Platelets, these are to help blood coagulate. Blood can start to back up because of high pressures in the veins, which is portal hypertension. Small veins can burst, and veins can even cause enlargement. So this is enlargement of veins. These are varices, and these occur in the stomach and in the esophagus. So they can rupture, and this can cause bleeding, life threatening. It could be hemorrhaging. It's called varicose bleeding. So signs of internal bleeding can be tar-like stools, or even blood in stools, or even vomiting blood. This can lead to blood transfusion. Fatigue, this is sore muscles, tiredness, moodiness, irritability. Weight loss, this is loss of appetite, and this can cause anorexia. Other risk factors of transmission, it can be transmitted during birth. About 5% of children can get it from their infected mother. So this is through vaginal delivery or C-section. Baby boomers, people born between 1945 to 1965. So CDC had an accommodation in testing people who were born around this time, because people of recipients of blood transfusion before the year of 1992 and recipients of liver transplants before July 1992. Later on, most of these blood donors were tested for hepatitis C, and most of them had it. So what happened was they wanted to identify more cases. So this is why they went back to the baby boomers. There were more than 3 out of 100 that were infected with hepatitis C. That was at least 5 times higher than any other group. This accounts for at least for about 75% of people who are infected with this viral infection. The process of how it enters the body. So the virus enters the extracellular matrix of the liver. The virus has a single-stranded RNA that is protected by a nucleocapsid. Outside of the nucleocapsid is a viral envelope. And at the end of the viral envelope is surface proteins. So when it enters the body, the virus is held by a lipoprotein. So it could be able to enter the hepatocytes, which are liver cells. They have tight junctions, and in between them are bile ducts, and this is where bile is able to flow through. Inside the hepatocytes are nucleus, and this is where the genetic material is kept. Around the nucleus is the endoplasmic reticulum, or the rough plastic reticulum. This helps house many ribosomes that synthesize for proteins from the messenger RNA. So what happens is a virus binds to receptors, and this is called attachment. This leads to entry of the virus, and it binds to liver receptors. Next is fusion. So the virus contains a lipid membrane, and this will fuse with the endosome and result to the release of the nucleocapsid into the cytoplasm of the liver cell. So what happens is that the virus will unwind, releasing the genetic material of the positive single-stranded RNA, which will be used to host ribosomes to make other proteins or its own proteins. The virus will then use the ribosomes and the amino acids. This is considered translation, and this will make many polyproteins. They will arrange themselves to form many other things for this virus. It can divide into two structural proteins, or it could divide into non-structural proteins for the virus. It makes a capsid on the a capsid on the surface, and for the structural proteins. And non-structural proteins will form the replication complex. So the endoplasmic reticulum membrane, the reticulum lumen, and the cytosol are involved in this process. So the non-structural protein will assemble to become the replication complex for hepatitis C, so that the single-stranded RNA will be replicated by the replication complex to a negative single-stranded RNA. This will then be used for a template by the replication complex again. And then this will form the single-stranded positive RNA. So on the endoplasmic reticulum, the replication starts to form many negative single-stranded RNA, and in turn will turn these into positive RNAs. So this will cause replication of the viral RNA. What happens next is the viral particle assembly, which will take an effect. This will help the endoplasmic reticulum with help of a lipodroplet by bringing the structural proteins. The single-stranded RNA is transported to the Golgi apparatus, and it's packed with lipoprotein from the ER. The virus will then go to the endosome and will be released to the extracellular matrix. And while this is happening, the lipoprotein will help hepatitis C invade other hepatocytes of cell-to-cell transmission of adjacent cells. How is it diagnosed? So blood tests need to be drawn, and they're sent to the laboratory. They are called anti-hepatitis C tests. So what they're looking for is antibodies that are in the blood test. Treatments, medications, antiviral medications. So these are people who suffer from the viral infection and need to be on certain types of medications so that the virus does not replicate. Immunosuppressants. So this lowers the activity of the immune system or the immune response so that the immune system does not attack itself. This medication is taken on a daily basis, and most of the time it's after a liver transplantation. And this is supposed to be taken for the rest of your life. Transjungular intrahepatic portosystemic shunt, or TIPS procedure. So this is normally performed by a radiologist. So the procedure is a small wired coil mesh, which is inserted into the liver's portal vein to the hepatic vein in the liver. It is a shunt that helps reduce the portal hypertension, which is pressure in the veins. It can help with internal bleeding, or the varices, or variceal bleeding. And that's the bleeding inside of the esophagus or in the stomach. This shunt helps to keep the connection open to be able to allow blood flow to circulate to the heart. while avoiding the liver. It may help in bleeding in the esophagus or in the stomach, but it is not a permanent treatment. And sometimes people could die and not even be able to live long with this treatment. Um, Liver transplant. So before having a liver transplant, the patient will need to be, of course, placed on a waiting list, and there's a mouth score, and this helps the doctors make a decision of the mortality rate. The mouth score, it's called the model for end stage liver disease. The score is from 6 to 40. How it's calculated. So it measures the serum of bilirubin, creatine, and international normalized ratio for prothrombin time, which helps predict survival rate. So basically, its purpose is to measure the severity of the liver disease. And the higher the number, the urgency to getting a liver transplant. The doctors will have to look for a donor who matches the patient's blood type and, of course, the liver's anatomy. But unfortunately, the higher the number is, the closer to death you are. But it's ironic how they want the number to be closer, because that is what gives you the urgency to have that liver transplant. The founder is Patrick Kamath, professor of gastroenterology and hepatology. It helps patients move up onto the waiting list. Liver transplant. So patients need to meet the mouth score. Patient has to be placed on the waiting list. And then, like I said before, doctors need to find a match, and a match to the liver's anatomy. So a liver transplant can take up to 6 to 12 hours for the transplantation surgery. So normally maybe it lasts up to 12 hours. And there are risk factors like hemorrhaging because of the lack of platelets, or heart failure or anesthesia could cause death too. Prognosis. So it could be different for many different people. Some people who have cirrhosis could live longer than others. And about 70 to 80% who are have chronic hepatitis can progress to chronic chronic cirrhosis in 20 years. So basically it's up to not up to the person, but not everybody has the same functions in their bodies. So after a liver transplant, the liver can reject in the first 6 months. So in this, after the liver transplant, the doctors need to closely monitor the patient. And normally the patient will have to go to the doctors maybe 3, 4, 5 times a month, depending on how their recovery is. Discovery of the virus. Scientists who discovered hepatitis C in 1987. So the first breakthrough was in 1987, and researchers from Chiron Corporation was Michael Honkton, PhD, and Kui Lim Cho, PhD, George Koo with his PhD. And they had a collaboration with Daniel W. Bradley at the center. So what they did was develop diagnostic tests by cloning or molecular cloning approach by hepatitis A and B. So in 1988, Harvey J. Alter confirmed the virus. And the Nobel Prize of Hepatitis C was to Harvey Alter, Michael Hongton, and Charles Rice. Their work also helped affected treatments for hepatitis C. A cure. So there are different types of cures now. Um, and they are very expensive. They could even go for $1,000 a pill, and they do have many side effects. Um, but they do work, and after being tested 3 times after the treatment, there's no sign of virus. Um, these are pills that are taken for 12 weeks at a time, or even 24 weeks, depending on how damaged your liver is. Even people with cirrhosis are able to take it.